Hello, hello. My name is Jones, and today we are looking at part 3 of our series of community psychiatry presentations. Okay, so part 3 is going to be divided into part 3A and part 3B. Okay, so in part 3A, we are going to look at levels of prevention of mental illness. And then part 3B, we are going to look at the role of a nurse in a tertiary prevention. Okay, so in community psychiatry, part 3, we are necessarily looking at levels of prevention or levels of intervention in mental health. So the levels of interventions or acting and taking a definitive step to reduce symptoms or mental illness from occurring includes mental health promotion and prevention. When we talk about prevention, it can be primary, secondary, and tertiary. Promotion and prevention overlap in the promotion and prevention overlap in that prevention is concerned with avoiding disease, whilst when you talk about promotion, it is about improving health and well-being. Promotion activities may therefore be similar to prevention activities. So when you're talking about health promotion, you're looking at ways of improving health and well-being. Then when you're talking about prevention, it is concerned with avoiding the disease from occurring within the community. For example, in a community, you might facilitate a cooperative for vegetable growing so that women generate an income for their daily needs and also improve on nutritional requirements of their children. By so doing, you are promoting good mental health because they will be relieved from stress of lacking money, from stress of what comes with poverty or lacking. They do not have to go looking for money very far from home. As they are selling these vegetables, they will be making money. So at the same time, this activity of vegetable growing is helping prevent mental illness that is developing because of unresolved stress, and it's also acting as a prevention measure of mental illness. So when you are strictly looking at mental health promotion, we are necessarily looking at any action that is taken to maximize mental health and well-being among population and individuals. When strictly we are looking at mental health promotion, we are just looking at all those mental health promotion activities or actions that can be taken to maximize mental health and well-being among population and individuals. Mental health promotion involves also actions to create living conditions and environments that support mental health and allows people to adopt and maintain healthy lifestyles. So this may include a range of actions that can help increase the chances of more people experiencing better mental health. So for this to be achieved, a climate that respects and protects basic civil, political, and social or cultural rights is fundamental in mental health promotion. Without the security and the freedom that is provided by these rights, it becomes very difficult or inevitable to maintain a high level of mental health. The national mental health policies also should not be solely concerned with mental disorders, but they should also recognize and address the broader issues which promote mental health. This includes mainstreaming mental health promotion into policies and programs in government and business sectors, including education, labor, justice, transport, environment, housing, and other welfare within the health sector in promoting good mental health well-being. Some of the specific ways to promote mental health include early child intervention. On early child intervention, here it can include home visits for pregnant women, preschool psychosocial activities, combined nutritional and psychosocial helps for those that are in the disadvantaged or vulnerable part of our population. So this specific way can help promote mental health within the community. The other ways to promote mental health within the community include support to children. We are supporting childhood intervention by supporting a pregnant woman. Now we can also give support to children. So how do we then support these children? It's by empowering them with skills, or youth development programs that will help them to become less dependent on others, that will empower them to have surviving skills. If they do not have surviving skills, then they might end up showing mental illness or mental ill behavior, or they may show ill social behaviors. The other ways of promoting mental health include social support for the elderly population, as they compose the vulnerable group that may develop mental illness. So we should have befriending initiatives and community day center for the aged, so that within these centers there will be promotion of good mental health well-being. Then the other specific way of health promotion to do with mental health include coming up with deliberate programs that target a vulnerable group. So vulnerable groups may be minority, indigenous people, migrants, or people affected by conflicts or disasters. So you can take health promotion measures within this angle and promote good mental health within the community. So now apart from all this, we can also do mental health promotion activities in school, where we have child-friendly schools. And within these schools there can be counselors, career master helpers that can help our children as they are growing up. Then the other ways of promoting mental health, now here we want to look at it at workplace. Is by having stress prevention programs, friendly human resource department with the counseling programs for health workers that might face challenges. Poor housing may lead to mental health challenges. As a person living without shelter may become depressed because of such issues. So we need to have housing policies and housing improvement policies that can help people build their own houses, in their country, as having a house will reduce the challenges or financial challenges of paying rentals. The other specific ways of promoting mental health is violence prevention within community. This can be achieved through policing initiatives that help the community to promote behaviors that are desirable. Then other community health promotion activity can include community development programs. Having a community care initiative that is integrated within the community. So when you're talking about health promotion activities, okay, to do with the levels of prevention, okay, of mental illness within the community, we can have activities targeting the pregnant mother so that she does not use drugs that may affect the baby, so that she has adequate nutrition, okay, for good development of the baby before it is born. Then when the baby is born, we should have programs for children that can empower them with skills, okay, so that they can become assertive and also be able to survive or adapt within the community. Then from supporting the child there, we can also have some socio-economic empowerment for women as they belong to the vulnerable group. So women belong to the vulnerable group, children belong to the vulnerable group, and the elderly belong to the vulnerable group. So special programs needs to be designed for these people, or people that belong to the vulnerable groups. Then apart from that, at work, having a friendly corner for those people that might be facing some mental health challenges. It can even be alcoholism, okay, and also having a violence prevention measure. So prevention, so now we have talked about healthy promotion. Now let us now concentrate on prevention. So we have mentioned that prevention is at 3 levels. There is primary, secondary, and tertiary. So the many ways of preventing health illnesses within our community is at 2 levels, promotion and prevention level. So when you're talking about prevention, then we are talking about the 3 levels that falls within prevention. So prevention necessarily means keeping a disorder from occurring in case of preventing mental illness within this topic that we are talking about, community psychiatry. So when you are preventing a disease, you are trying to keep that disease from occurring within the community. So prevention activities are carried out through specific protective measures, that is through promotional activities and also risk reducing measures. Okay, so that is risk reduction measures of individuals or families or people within the community that are at risk. So in the community, mental health prevention occurs at 3 levels, that is primary, secondary, and tertiary. Okay, so when you're talking about prevention, it's carried out through specific protective measures, that is promotional activities and reducing risk factors in the lives of individual, family, and the community. And then for the community, we look at it in terms of primary, secondary, and tertiary. So let us now in detail look at primary prevention. You have to remember that within this lesson, we said that when you're talking about promotion activities, they may tend to overlap with the prevention activities. So here now we want to look at primary prevention. So primary prevention involves both mental health promotion. Okay, so when I'm saying it involves both mental health promotion, here I mean enhancing protective factors. And then it also involves prevention of disorders. So by saying it involves prevention of disorders, here we are necessarily looking at reducing the risk factors that is within the lives of individuals within our community. So what is primary prevention? So primary prevention, okay, is a type of prevention that involves both mental health promotion and prevention of disorders in the lives of individual. Promotion and preventive activities in mental health care delivery, okay, has been shown to overlap, and that is why we are looking at enhancing protective factors and reducing risk factors as part of primary prevention. Okay, so When you're doing primary prevention activities, you assist individuals to increasingly cope effectively with the stress. And then when dealing with primary prevention, you are going to target and diminish stressors in the environment. So this can be done through education of risk groups in key areas. Okay, so what would be some of the key areas in which you can educate groups within the community to prevent mental illness? So you have to teach parenting skills and child development to prospective parents. They need to know some of the crises that the children pass through as they are growing, so that they can groom their children to be stress-free or have socially prescribed desirable behavior. So teaching parenting skills. Then you can also teach physical and psychological effects of alcohol, drugs, and other things that minors or children may be involved in, so that they avoid them to in order to reduce the risk factor of developing mental illness. So the other teaching technique of stress management also can help children or people within the community to avoid being at risk of developing mental illness. So people within our community need to know how to manage stress, because too much stress may lead to depression and manifest as a mental health condition. Okay, the other ways of primary prevention within a community, okay, or how you can do primary prevention within a community, is teaching groups of individuals ways to cope with changes that are associated with various crises or challenges that we face within our community. It can be menopause, retirement, unemployment, and the likes. Then you also have to teach the concept of mental health to various groups within the community, or necessarily do mental health promotion within the community as a primary prevention measure. Providing education and support to unemployed and also homeless can help prevent diseases within the community. So when you're talking about primary prevention, here we are necessarily looking at the education resources that you can give to the community, so that you prevent the disease from occurring, so that you enhance the protective factors that can shield the community from having mental illnesses. So it's important to note primary prevention is about enhancing protective factors and reducing risk factors. And these within primary prevention can be achieved through teaching. Teach parent skills, teach stress management, teach life crises that one passes through as they are growing up. When this one you can refer to Eric Erickson, who talks about some of the challenges or crises that one passes through, and also improving education awareness about mental illness. So these are some of the teachings in primary prevention that can prevent mental health condition. Okay, so with primary prevention tackled, let us now look at secondary prevention. Secondary prevention is more about treatment, because in secondary prevention the disease has occurred in the community. So what you are necessarily trying to accomplish is reduce the severity of that disease and the possibility of having complications. So secondary prevention, that is the prevention over the disease in order to reduce the severity of mental illness. This can be achieved through decreasing or reducing the prevalence of psychiatric illness. And this can be done through shortening the course of illness by the treatment that has been given. Okay, so apart from that way, this can be achieved through identification of problems and also promptly treating these identified problems with available resources. Okay, then the severity of the condition can also be achieved through nursing in the that is nursing the patients with a mental illness, and also recognizing of symptoms and provision of referrals. Okay, those that have the diseases, you nurse them, you give them the best nursing care that is there to help them improve. Okay, then also you also recognize symptoms within the community so that people can be treated early. Secondary prevention measures may also include ongoing assessments of individuals who are at high risk of mental illness. Of course, such an activity can be achieved during home visit, during daycare, or primary health care clinics, or any setting where screening of high-risk individuals may occur. So here you are going to achieve secondary prevention. Other ways of achieving secondary prevention is provision of care for individuals in whom illness symptoms have been assessed. Like you can give counseling, you can continue giving the drugs that have been prescribed, and also offer support to individuals that have that are experiencing some kind of stress. So you bring in a crisis intervention measure. You can do secondary prevention by counseling people who have tried to commit suicide, counseling people that might have abused children. Okay, you can achieve secondary prevention by having a contact line, okay, where people can easily access help, okay, or victims can easily access help. Okay, so secondary prevention is achieved also through referral for investigation and treatment of individuals with symptom, and also the secondary prevention is achieved through psychiatry medication or therapies that will be given. Okay, so secondary prevention chiefly is about treatment. So the treatment that you are going to give, diagnosis that you're going to give, the recognition of the symptoms and symptoms within the community. Then we have tertiary prevention. So tertiary prevention is about rehabilitation. So when I'm talking about tertiary prevention, we are necessarily looking at the reduction of residue effects that are associated with severe illness, such as loss of social skills, inability to earn a living, and also side effect of neuroleptics or psychiatry drugs. Okay, tertiary prevention, we are also looking at stigma and discrimination that people that are recovering from mental illness may suffer from. So most common illnesses with residue defects are epilepsy and schizophrenia. Okay, so how can you accomplish tertiary rehabilitation? So tertiary rehabilitation can be achieved through preventing complication of the illness, and also promoting rehabilitation that is directed towards achievement of each individual's maximum level of function. So when you're talking about tertiary prevention, you are necessarily looking at rehabilitation and reducing the sequel of the disease from necessarily happening. Okay, so you don't want complications to happen, so you have to reduce the complication of a disease to happen. So tertiary prevention, about rehabilitation. Okay, so part A of our presentation to do with community health is just necessarily looking at how we can, it is just looking at how we can intervene in mental health, or we are looking at the levels of intervention in mental health. So the levels of intervention in mental health are two. There is health promotion and prevention. So health promotion composes activities that are done, in order to promote the well-being or mental health well-being of individuals. Whilst when we talk about prevention, it is concerned with avoiding the disease from happening within the community. And it's important that we also appreciate that promotion activities and prevention activities may overlap. Then, when you're talking about prevention in our community, it is at 3 levels. There is primary prevention, secondary prevention, and tertiary prevention. When you are discussing primary prevention, it involves activities to do with education and teaching of vulnerable groups, that is pregnant women, children, the elderly, and also those that are working, promoting health, promoting their mental well-being whilst they are executing their duties or they are working. Then when you look at from primary prevention, when you look at secondary prevention, this is about ensuring that the treatment given is adhered to, and it also involves detection of diseases, the recognizing of the symptoms within the community so that people are treated. Then there should be ongoing assessment of individuals at high risk, high risk of the disease, and also provision of investigation and treatment for these people so that the condition does not end up with weak complications. Sometimes complications are inevitable. That's why we have tertiary prevention. Tertiary prevention is about rehabilitation so that we reduce the effect of complication to an extent where an individual is able to function. So most common illnesses that may have a residual effect is epilepsy and schizophrenia. So tertiary prevention can be achieved through prevention of complications and also promoting of rehabilitation activities. So in part B, we are going to look at nurses' role in tertiary prevention. So otherwise, for part A of part 3A of this lesson, those are the items necessarily that we have looked at. That is how the levels of intervention in mental illnesses. So the main levels are 2, promotion and prevention. Prevention in our community can be looked at 3 levels, that is primary, secondary, and tertiary. So thank you very much, and please ensure that you also listen to the other lesson that is following to do with part 3, to do with nurses' role in the tertiary level, so that you can appreciate the levels of intervention in mental health. So thank you and keep studying.